Hello, my name is Susan Hogan. I'm one of the cardiac rehab nurses in Halton Healthcare, and I'm here to talk to you about risk factors of heart disease and medication. And one kind of falls and flows into the other. So this is my agenda of what I want to talk to you about. I want to talk to you about what are cardiac risk factors and what is my own risk of heart disease. I'm going and pertaining to you. Why are you taking all these medications? I hear this all the time from people say, Susan, I was never taking any medications in my life and suddenly the doctors put me on 5 or 6 medications. What is that about? How long do I need to be on these medications? And will I ever be able to come off them? What are the side effects of the medications? I'm going to be talking about that. Newest evidence about the medications, and at the end of this, you should be able to know more about your medications and go forward. These are some of the terms that we use for heart disease just to start off. So just to let you know, if you're watching and looking at your chart upside down at your doctor's desk, and if you see the word CAD, it doesn't mean you're a CAD, it means coronary artery disease. And if you see SOB, it doesn't mean you're an SOB. It means shortness of breath. But these are terms that you might see in this kind of short-term Latin sometimes. But let us explain to you in normal, everyday language what these things mean. What happens if you have cardiac risk? Now, we discuss cardiac risk in 2 different sections. One is non-modifiable risk factors, and these are things that you can't do anything about. You can't do anything about your age. You can't do anything about being a man, well, or a postmenopausal woman. You can do some things about that, but this is not the forum for that. You can't do anything about your family history. You can't do anything about having a previous heart attack or stroke, which automatically puts you at a higher risk level. But there are things that you can do. You can change these modifiable risk factors. Smoking is the #1 risk factor that we see in playing a part in heart disease. Smoking is so important. It's the #1 concern. So if you're continuing to smoke, we can almost certainly see you again in an emergency room if you continue to smoke and if you have coronary artery disease. So smoking would be like up here, and if you have needing diet changes, that would be down here. They're both important, but smoking is super important. Abnormal blood lipids, and they are the cholesterol and the triglycerides that you see. You would get in the cardiac rehab program. We let you know what they are. We let you know what the targets are, and how you compare. We want usually to be kept your LDL and your HDL and your total cholesterol. We look at all of these things, and your triglycerides. High blood pressure is another risk factor that increases your risk for heart disease because it puts pressure against your whole artery system and makes it more susceptible to getting coronary artery disease or any of the plaque buildup inside your arteries. We like to see in cardiac rehab, your blood pressure to be less than 130/80, and if you have, or 130/80 if you have diabetes. If you don't have diabetes, less than 135/85. Even lower if you can. But sometimes if you have had very long-standing high blood pressure, say 180/100, and we suddenly bring it down to 110/80, you're going to feel it. You're going to feel less blood pressure. You're going to feel lightheaded and dizzy, where you're more likely to. Physical inactivity is another risk factor. What we like to see in the cardiac rehab program, by the time you have left, you should be exercising, which means intentional exercise, something that you do in order to raise your heart rate. We'd like to see you doing that 4 to 6 hours a week, 5 to 7 days a week. Diabetes, it's like having 3 risk factors, 2 to 3 risk factors. It does increase your risk overall. Abdominal obesity, so that fat that we tend to carry around the middle is more harmful than other fat in the body. The target for lowering the abdominal obesity, we'd like to keep it less than 102 centimeters for men, usually, and 88 centimeters or 35 inches for women, less than that. It just reduces your risk overall. That being said, obesity by itself, it doesn't mean as much as we used to think. It's more what you do about it. Even our dietitian has in her office a poster that says, losing weight in an unhealthy way is still unhealthy. Stress is another modifiable risk factor, which is why we'll ask you intentionally questions to see if you've had a lot of stress. And we have a social worker counselor in our program. We wouldn't have her if we didn't know that it made a difference to people and lowering their own risk. We know that it makes a difference. Because stress increases inflammatory hormones in the body, which makes it more likely to put that plaque build up in your arteries. It's seen more in the angry or hostile response to stress. The nice thing about knowing that there are modifiable risk factors is that you can do something about them. So these modifiable risk factors that I have here, they account for 90% of all first heart attacks in the world. That's incredibly uplifting when you think about it. This is something that you can do something about. So drug therapy is important, but lifestyle is very important as well. So getting into a regular habit of not only taking your medications, but also lifestyle, exercise, and what you eat is also just as important. And keeping less stress in your life, increase social support. So what happens when you have known coronary artery disease? Once we know that you have it, how do you manage it? You can manage it with, you can control the risk factors that I just talked about, like high blood pressure or cholesterol or stress, that sort of thing. Lifestyle changes and medications. Medications are needed to protect the heart. How do they do that? They work in different ways, and some of them might be different than what you think. And I'll talk a little bit more about that. Some decrease the oxygen demands of the heart. Some increase the blood supply to the heart by opening up the blood vessels. Some stabilize the coronary artery plaque. And by that, the coronary artery plaque, I mean the buildup inside the arteries of the LDL, the lousy cholesterol, and the calcium and the inflammatory molecules, making that paste that hardens over time inside your arteries. But it's more unstable. It can get these lesions and fissures that can attract the platelets that decrease the blood flow downstream that can cause a heart attack. So this would stabilize that to make it more like Teflon. Some make those platelets less sticky so that they don't hold hands and cause those clots to form as easily. And some control those risk factors like high blood pressure, like high cholesterol, that sort of thing. You all have a list of your medications that we give you in your binder. If you have any questions, please ask us. And also, your pharmacist is a really good source of information for you. You should go to the same pharmacist all the time, so they have a list of the medications that you're normally on, and they can see if you're taking anything over the counter to compare, to see if these are safe drugs for you to take. Still, some people haven't always taken their medications, and we understand why. I think one of the reasons they might be because of lack of money. If lack of money is truly a problem, there are programs in place. You can talk to your doctor, you can talk to our social worker about getting help with that. You might have to show your tax forms from the previous year, but there are plans in place to help people if they really are in need. Because 25%, this was a big study that was shown, that was a number of years ago, that showed in one of the downtown hospitals in Toronto, 25% of heart patients discharged from the hospital didn't even fill the prescriptions. And 50% did not take them as prescribed. Now, it's not necessarily the same population as Oakville or Milton hospitals, but that's still very high. Those who filled only some had 44% increased odds of death over 1 year, and those who filled none, up to 80% increased odds of death over a year. So that shows how important it is. So it's important for you to know the reasons to take the medication and to get the right information. There's a lot of misinformation on the web. So it's good to go to valid and reliable sources, and we can help you with that as well. And you can ask us, you can ask your doctor and your pharmacist. I'm going to show you how to look at medications in a generic form and tell you what kind of class of medication it is, most of the time anyway. Another thing that we would like to do, or the doctors, the healthcare system would like to do, is reduce your pill burden, because we know the more pills you take, the more sick you feel. And so there's now combination pills that you'll see 2 different pills in one to reduce that pill burden, and you'll see those combinations as I'm going forward. There are some places in the world that actually have 4 different medications in one, and they give it to the same dose for everybody, though it's not really the same kind of healthcare system that we have, but it still has been working for them, and to reduce risk and reduce heart attacks in populations at risk. That's fairly new information, and it's pretty interesting. The first class of drugs I'm going to talk to you is called the ACE inhibitor. You don't have to remember angiotensin-converting enzyme inhibitor. ACE inhibitor is a class of drugs used for congestive heart failure. And congestive heart failure means that the body is, or the heart is not keeping up with the body demands, so that there is sometimes congestion or fluid buildup in the lungs. You might see it in the dependent areas of the legs and down in the ankles. The heart is just getting weaker. And they're also used for coronary artery disease to make the insides of the arteries nice and stable. So it's not just for congestive heart failure, it's also for high blood pressure, and it also helps make it nice and smooth inside those arteries. So it helps decrease the platelet aggregation or filling up in the arteries. ACE inhibitors are also good for anyone who has diabetes over time. They've got more risk of getting kidney problems. And we don't know exactly why. They just know that it does work to take these ACE inhibitors to reduce kidney problems as a long-term complication for diabetes. ACE inhibitors are also called the Prills sisters. The Prill sisters, because they end in Prill in the generic name. Every pill has a generic name and a trade name. The generic names are generally longer. The trade names are often easier to pronounce. But you can tell by looking at the generic name, usually, what class of medications they're on, or that they are. So these are some of the names. The ones we often see are Perindopril, Ramipril, any of these ones. And then you can see the combination pills of an ACE inhibitor and a diuretic. A diuretic is a medication that makes you urinate more to get rid of extra fluid. What more about ACE inhibitors? What do? They inhibit, they're called angiotensin-converting enzyme inhibitors. What they do is they inhibit an enzyme that makes a chemical called angiotensin II that's produced by the kidneys. It's the kidneys that actually control blood pressure in your body. But this angiotensin II squeezes the blood vessels or the arteries closed. And what this does is it inhibits that, it opens them up. What happens when you open up a pipe full of water? The pressure goes down, right? So this decreases the blood pressure, making it easier for the heart to pump against. Now, these ACE inhibitors also, they show 22% reduction in heart attack and stroke and heart failure. And this is significant, which is why most people who have had any heart disease, if they can tolerate this drug, are put on ACE inhibitors. And they're often used for people who have had long-standing diabetes. Every medication has side effects. Even Tylenol has side effects. The question is whether this side effect affects you and if it bothers you. If it does bother you, please talk to your doctor about it. Do not take this medication, any of these medications off on your own. Your doctor can switch medications or titrate the dose of medications, but it should be done under medical supervision because they do have consequences if you take them off. And it can have rebound effects that make you more susceptible to having a heart problem. ACE inhibitors can make you not feel low blood sugars too, so that's a side effect to be aware of. So you might want to test, we want you to test your blood sugars to make sure that they are stable. ARBs are the next type of medication I'm on. These medications end in sartan in the generic name. They're very much like ACE inhibitors. Then you can get those combination pills that have the diuretics as well as the ARBs to reduce that pill burden that I was talking about. ARBs they work basically the same way. They end up opening up the blood vessels, decreasing the pressure inside the artery. And so it makes it easier for the heart to pump. They do have side effects though. They decrease certain chemicals that cause salt buildup in the body and therefore fluid. We do see them sometimes combined, but usually you take one or the other. ACE inhibitors, sometimes one of the main side effects is a cough. And you will know it if you have it. It's a bothersome dry cough. Bothers you, you'll tell your doctor. Your doctor will just say, okay, I'll take you off this ACE inhibitor and I'll put you on an ARB medication, which doesn't have that as a side effect. Entresto is a new class of medication that came out a couple of years ago. It's a combination drug. It's got an ARB in it called valsartan, ends in sartan, but it's also another drug in there called sacubitril. And they are really good for heart failure to reduce blood pressure and the work of the heart, reducing the blood volume as well as opening up the arteries and increasing blood flow. But they have been shown to be really useful because they reduce incidence of heart failure, hospitalizations, or cardiovascular death by quite a lot, by 20% reduction in death over 1 year, which is significant. But Entresto also has side effects like low blood pressure, a cough, dizziness, and kidney problems. So you will be monitored for blood kidney potassium levels as well. If you are taking lithium, you can get lithium toxicity with Entresto as well, so they would monitor that as well. The next type of drug class I'm going to talk about is the antiarrhythmic drugs. Why do you take antiarrhythmic drugs? Well, if you have an arrhythmia or an irregular heartbeat that is causing problems. Not every arrhythmia needs to be given a pill for it, but there are some that can be harmful and we want to suppress them. These are some of the medications that are useful for keeping those extra heartbeats at bay. Some work on the top part of the heart, some work on the bottom part of the heart, some work on the whole heart. And depending on what kind of arrhythmia you have, you'll have a different type of antiarrhythmic drug, and depending on how well you tolerate it too, makes a difference. These are some of the reasons that you might be taking an antiarrhythmic drug. One might be atrial fibrillation, if you've ever heard of that. That means the top part of the heart is kind of fibrillating, and it tends to make the heartbeat go very fast, and it's irregular, and it has some problems associated with it. So we want to suppress it if possible. And the right side, you'll see that's a normal rhythm, but you'll see some irregular heartbeats, those kind of wide, bizarre shapes. Those are coming from the bottom part of the heart. It's okay if you have them once in a while, but if you have a lot of them, it can cause a problem and decrease blood pressure and cause problems with that. So antiarrhythmics are used for that type of rhythm. These are just two types of arrhythmias. There are different types as well, but these are two of the major ones that we see. Beta blockers are one of the medication that are used to suppress those irregular heartbeats. So they are antiarrhythmics as well, but they're a separate class of antiarrhythmics. We call them the LOL sisters because they end in LOL in the generic form, not in the trade name. And then you can get those medications that are the combination pills, for instance, with a diuretic, which is usually the same dose all the time. The ones that we usually see are bisoprolol, which is taken usually once a day, and metoprolol that is usually taken twice a day, although there's a new formula that's taken once a day as well. But other ones are used as well. What do beta blockers do? They're used to treat angina as well and congestive heart failure. It's very often after you've had a heart attack, myocardial infarction with damage to your heart muscle. It also controls those abnormal heartbeats, an important reason. And because after you've had a heart attack, you're more susceptible to having those irregular heartbeats as well. And they also control angina and prevent those any further problems with your heart, further heart attacks. What do? The long word for beta blockers is beta adrenergic blockers. So it prevents adrenaline from affecting your heart. What does adrenaline do? Adrenaline is that fight or flight hormone in the body that is emitted if you sense danger. For instance, if you're, in our prehistoric past, if a tiger was chasing you, your heartbeat would go much faster, your blood pressure would go much stronger, all your blood flow would go to your heart and to your muscles to fight or flee. It would make you breathe better, it would make your pupils expand, but this would affect, beta blockers block that effect. So it blocks that effect to the heart, so it slows down the heartbeat. Because in today's life, what often makes us feel that stress is everyday stresses like driving, right? Or my taxes are due. All sorts of stresses in everyday life that can affect your blood pressure and your heart. But I often compare, if your heart compare it to a balloon full of water, and you put it in a straw. You attach it to a straw with elastic rubber band, and you push all that water into that straw. If you push hard, you're not going to make it go through the straw any faster or better. At a certain point, it just is going to cause harm to the balloon and to the straw. Think of that. It's just decreasing the force needed for every heartbeat, and it slows it down so the heart can heal properly, and it makes it more efficient and improves the heart's pumping ability over time. But like every medication, beta blockers have side effects. Fatigue or tiredness, slow heart rate, decreased libido or sex drive, vivid dreams, feeling cold, depression. It can also mask if you have low blood sugar, so that you would need, before and after you exercise, we ask you to take your blood sugar before and after when you're here in the gym. It does increase your asthma, shortness of breath, but really only in the very high doses. We don't see it usually in the community. But this is why beta blockers are so important. You can see up to a 40% reduction in mortality or death rate, 18% reduction in having another heart attack. It does, this is one of those medications that you should not stop suddenly because it can have a rebound effect and can cause another heart attack. That's it for beta blockers. I'm going to talk about calcium channel blockers now. Now, sometimes you can tell by looking at the generic name that it's a calcium channel blocker, but not all the time, but some of the time, that ends in PINE. So take a look and see if you're on one of these medications. These calcium channel blockers were usually given before beta blockers came along after a heart attack. But now, but they still have their use for reducing blood pressure. They're used to reduce high blood pressure and prevent angina. What do? They work on blood pressure in a different way. So instead of opening up the blood vessels because they're with the angiotensin, reducing the angiotensin effect, it prevents calcium from entering the cells, the smooth cells that go around the blood vessels. So it makes them, what calcium does is make them more contractile. So it reduces that effect inside the smooth muscles. So it opens up the blood vessels in a different way. So makes the heart arteries relax, decreasing blood flow, decreasing the work of the heart, and allowing them to heal. Bringing more oxygen to the heart and lowering blood pressure. But they do have side effects, like every medication. Swelling of the ankles is one that you see. If you have that, tell your doctor. Headache or a dizziness or a flushed feeling is usual, or they're the more common side effects seen. Now, when I'm talking about side effects, most of the time, side effects are not felt by anybody, but there are some people who do have them, maybe 5%, depending on the medication. Let me talk a bit about grapefruit juice. You should avoid grapefruit juice with this medication. There are a number of medications that we know now that we didn't know before, years ago, that affected medication and how the medication affects the body. So this is one of these medications that you do not take grapefruit juice. Used to be people were taking their grapefruit juice in the morning with their pills. They thought it was all healthy, but it's really not if you're on certain medications. This is why more medications have been added to the list that are affected by grapefruit juice. What grapefruit juice has been doing is not allowing the molecules from the medication to be excreted by the body. So it's been building up to toxic levels over time and giving you more of a dose than you really want. Your doctor, your pharmacist will always put a little sticker on your medication to avoid grapefruit or grapefruit juice. Other like oranges might have some of the molecule that is like the grapefruit juice, but not nearly as much. Sometimes you can substitute a drug if you really want your grapefruit juice. But talk to your doctor about it, because they can really affect how your medication reacts in the body. Cholesterol-lowering agents. There are different types. Statins are the #1 that you usually see. Statins end in the generic name, it's statin. That's why they're called statins. But they have different trade names. The ones that we see the most are Lipitor and Crestor. They're the ones that are usually the strongest. They work the best. But the other ones certainly have their uses as well. What do? Well, cholesterol is formed by the liver. Every night it produces cholesterol. And cholesterol is important for the body, but if you have too much, especially the bad kind or the LDL, it mixes in with that. You have more of that and it makes more plaque inside the arteries. But also statins, even if you have normal cholesterol or cholesterol that is not high, doctors will often put you on that after you've had known heart disease because it also reduces inflammation in the arteries, which we know is a risk factor for heart attacks. They also stabilize that fatty plaque inside the arteries. So when you have the plaque, it's less stable than the usual lining in the arteries, and it's more liable to get fissures that attract the platelets, that decrease the blood flow and can cause a heart attack. So that's why statins are important. But they do have side effects. Headache, skin rash, stomach upset, constipation. I hear a lot about weakness or sore muscles and joint pain, more than any of the other side effects. It can cause damage to the liver, but it's really 1 in a million chance. And once you take that medication off, it gets better. The effects are reversible. And certain antibiotics should not be taken. And your doctors know what they are, the pharmacists know what they are if you're taking a statin drug. That's another good reason to always go to the same pharmacist and always have a list with you in your wallet to show your healthcare personnel, because it should be kept up to date and they should know what your medications are before they prescribe a new thing. Statins, there are some statins that you shouldn't take with grapefruit juice as well, including Lipitor. So check to make sure you're not on one of those medications taking grapefruit juice. Liver function tests are usually taken before you start a statin, because if you do have if you're not feeling well, you talk to your doctor. Your doctor will take liver function tests just to make sure that it's not the statin that's causing the problem. Muscles can be, some people experience sore muscles and joints, and if you have that, talk to your doctor. Please do not take yourself off this medication. It can, again, have one of those rebound effects that can be harmful to you. The doctors can work with you to either change the medication or change the dose, but do it under medical supervision. Please don't take yourself off this medication. But this is why statins are useful, because it stabilizes the plaque. There's a 30% reduction in cardiac events with the higher doses of the statins. One study was even shown to be of such benefit that they stopped it because they considered it unethical to not give people statins, because it did so much good to everybody. It was very obvious. But statins showed, compared to people who were not taking statins, there was a 36% reduction in further cardiac events, which is quite significant. That's why statins are such a useful drug in the toolbox for doctors to use. The higher doses of statins have now been shown for the past few years to actually reverse the plaque buildup in the arteries. Not by a lot, maybe just 1 or 2%, but this was big news when this occurred a few years ago, when this was discovered, and because nothing else had been shown to do that before. PCSK9 inhibitors are a new type of drug. It's just been out for the past couple of years. It's a new type of drug, injectable. It's doing a very good job of reducing the cholesterol in the blood, because we know the higher the cholesterol levels, the more likely it is that you're going to get that the plaque buildup. So this works because it inhibits a protein that's made by the liver that increases the lousy cholesterol in the bloodstream. There are some people who do not react well to statins, and there are some people who, even if they're on statins, because they're genetically predisposed to keep their cholesterol up. So this is another drug in the toolbox that's just come out that we're now seeing. It is very expensive. It's over $6,000 a year, and it is injectable every 2 to 4 weeks. But it is another tool in the toolbox that is very useful. There are other medications that are useful. Diet is also useful to reduce your cholesterol. It may account for about 20% reduction. If you can change your diet, you can reduce your cholesterol by maybe 20%, but the medications are very useful as well, not just to reduce the lousy cholesterol and the triglycerides, but it helps keep the plaque nice and stable inside and reduce the inflammation. So fibrates are one type of medication to reduce that triglycerides. Triglycerides aren't really a cholesterol. It's a type of fat in the body that does increase risk. So this reduces that well, and the LDL, and it increases the HDL, which helps whisk away the bad cholesterol too. So that's one of the, it's not as effective to reduce the cholesterol as statins, but it's still useful, sometimes added on to a statin. But they do have side effects: stomach upset, nausea, diarrhea, and headache, and muscle aches. Another type of medication to reduce the cholesterol is called Ezetrol, and that works in another way. It keeps the cholesterol in the food, in the gut, and it prevents it being absorbed from the gut into the bloodstream. So it works a different way, but it does have side effects, usually stomach upset, gas and diarrhea, that sort of thing. Digoxin and Lanoxin are a type of medication that is used. We usually see it used in emergency room, and it's from Roman times, comes from the foxglove plant. It is very useful for congestive heart failure. We still use it in emergency room, not so much in the community as much. It strengthens the heartbeat, and which is good for heart failure. Diuretics are another class of medication. There are different types of diuretics. They work on different parts of the kidney to increase getting rid of extra fluid, making you urinate more. We sometimes call them water pills. And it helps reduce that extra fluid buildup that you see, especially in heart failure or congestive heart failure. And it also reduces blood pressure, because you know the more fluid you have in the pipes, the more pressure there is. So it helps get rid of that extra blood pressure. There are different types, and you'll see them used. There are different tools in the toolbox for the doctor to use. They do have side effects: tiredness or weakness or dizziness. That makes me think that maybe there's too much, but it is just it's a side effect. Thirst or dry mouth, numbness or tingling in your toes or your fingers or your lips. Nitrates are another type of medication I'm going to talk to you about. They come in different forms. They come in pill form. They can be in patch form or ointment that you might be putting on with angina or after you have surgery, or they come in intravenous form that's used in the hospital. What does it do? It prevents and treats angina very fast acting, and also you can get the patch form if you've had open heart surgery or bypass graft. It prevents vasospasm in the grafts, making them less twitchy. They dilate the blood vessels very fast, and they're used to treat the angina. Nitro spray is usually carried by anyone who has angina or has potential to get angina, and the doctors will prescribe it for you. Now, when you have angina, sit down if you have chest pain, anything above the belly button. So that includes It can include your chest, it can include your shoulders, down one or both arms, even jaw pain. Even in the back, it can be pressure, not pain. If you have this sensation and it's your heart, sit down. If you're exerting yourself in any way, either physically or mentally or emotionally, sit down, relax. If it doesn't go away within 5 minutes, take out your nitroglycerin spray that you carry with you at all times in your pocket or in your purse. Don't separate it from yourself. And if you haven't used it for 2 weeks, spray out the room first, just to clear the tubing. You don't shake this because there's air bubbles that can form. So just spray out the room. Take one spray at a time underneath your tongue. Just one spray, not more. I've had one person who told me a while ago, said, Susan, I know, I took 3 sprays at once. Well, he fainted and he woke up and people were looking at him down, he was on the floor. And I'm not telling you that to make fun of the person. He's a very nice person, but only take one. Otherwise it lowers your blood pressure too much. So if one doesn't work, after 5 minutes you can take another one. If it doesn't completely go away, you can take a third one. But if you need the third one, just call 911. Don't drive yourself, please. Just call 911. They can take you to the right place at the right time. They can give you some medication inside the ambulance, in fact, and see if you're having a heart attack. What we want to prevent is a heart attack, which means that there's cell damage to the heart. Nitrates do have side effects. Headache, the nitroglycerin headache. So if you have a headache, it's caused by the opening up the blood vessels, not just to the heart, but the head too. So it's kind of engorging your head. One way to prevent that or to treat it is put an ice pack, put a cloth between you and the ice pack behind your neck. Just put it around, and that helps get rid of the headache. Tylenol works as well, but this is faster. A fast pulse, flushed face and neck, and dizziness are also side effects. If you take Viagra or any of those other medications like Cialis, please do not take nitrates because they can lower your blood pressure and it's very, very difficult to bring it up and it could lead to death. So if you're taking any of those drugs, do not mix the two. The same goes for herbal medications that would cause the same effects. Platelet inhibitors are another type of medication, and they're used, one of them is aspirin. The baby aspirin, you're usually 81 milligrams a day that you take in combination with one of the other types of medications, Plavix, Effient, and Brilinta. Usually Brilinta is used now, but the combination of aspirin and one of the other drugs, it's like synergistics. It's one and one make 3. The two of them make a better combination instead of taking too much of one with side effects of that. What do? They prevent heart attacks and strokes, and after you've had angioplasty and the stent, it helps prevent the platelets from sticking together and forming clots, especially inside that stent for at least the first year, to prevent platelet aggregation, causing decreased blood flow. But they do have side effects. Irritation of the stomach is number 1, up to pain and vomiting in your stomach. Itchy skin, usually Plavix or the Brilinta is stopped before surgery, but not baby aspirin if you need it. And that would only be for a short time. Platelet inhibitors are so useful in our toolbox for treating coronary artery disease that this is why 25 to 33% reduction in further cardiac events with aspirin and Plavix, and it's even a little bit more with the newer medications. The newer medications like Ticagrelor or Brilinta, they are a little bit more effective than Plavix, and they start working more quickly than Plavix. They are more expensive than Plavix, or clopidogrel is the generic form. And but some people don't respond well to Plavix, and so they need to be put on these other medications. The biggest side effect that we see with ticagrelor or Brilinta is shortness of breath, and let your doctor know if you're experiencing that, because then they might switch you onto another medication. Different populations might be either taking the prasugrel or the one pill or the other, the Effient or the Brilinta. Okay, I'm going to talk a little bit now about non-steroidal anti-inflammatory drugs, or NSAIDs for short. What are NSAIDs? They're those medications that you often take for headaches or muscle or joint pain, like Aleve or Advil. Aspirin is one type of NSAID, but there's the other types are harmful to the heart, so please do not take them. They're more risk of heart problems and bleeding problems. So if you're on any of these medications, please do not take them. Now, there are some people who say to their doctors, I can't live without taking my Aleve or whatever they take for their arthritis. Please talk to your doctor before you take them. There are some people who do take them, but they've had that discussion, that very adult discussion with their doctor about what is more important to them. Anticoagulants are another type of medication. They're not the same as antiplatelet drugs. They interfere with the actual clotting cascade, which is one of the many different actions the blood has to make a clot. Warfarin was the only one that we had until about 2011, but since then there's been new ones that have been made. These are the most common ones: dabigatran, apixaban, rivaroxaban, which are new anticoagulants. They don't need to have blood tests done. Just like warfarin, you need to have INRs taken by a lab every 2 weeks or so, just to make sure you're in the right range. And the other ones are more stable and they don't require that, which is a really nice thing. People don't need to have their blood tests taken all the time. Previously, there wasn't an antidote. There is an antidote to warfarin. At first, there wasn't an antidote to the other new ones, but now there are. For the past couple of years, there are antidotes for that since 2016. Anticoagulants are used in cardiac rehab a lot by people who have atrial fibrillation, when the top part of the heart is fibrillating and can cause clots to form in the atrium, and this prevents that from forming. And why do we care about clots? Because they can break off and cause a stroke, and we don't want that to happen. But they can reduce the risk of stroke by 64%, which is significant. And if you have had a heart attack, sometimes what happens if it's a heart attack, the part of the wall is not moving. It's called akinesis. And if it's not moving, it can cause a little pouch or a little part of the heart that can cause a clot to form. And you would need anticoagulant for that as well. If you're on Coumadin or warfarin, you need to have the blood test. For the other ones, you don't need to, but they still need to be stopped before surgery. And so let them know, of course, if you're having any bleeding. You're at more increased risk of bleeding. That's the major side effect. So these are things to tell, if you have or experience any of these things, call your doctor right away, or even go to emergency room. These are some of them. Bleeding that is severe, you cannot stop. If you've got pink or brown urine, that is blood. If you've got red or black stools, it looks like tar, it's very smelly, that is blood. If you've got bruises and you don't know where they came from, you've got no idea, tell your doctor. If you're coughing up blood, that is blood. Go to emergency room. If you're vomiting blood or coffee grounds, you need to tell your doctor. If it's a lot of coffee grounds, just go to emergency room. They need to monitor you. Coffee grounds, that is blood that's mixed with the stomach juices. Unexpected pain or swelling or joint pain, and say if your elbow or something blows up, go to emergency room. If you're on a blood thinner, you're more at risk for bleeding. Headaches, feeling dizzy or weak suddenly, then tell your doctor. And go to emergency room if you think that you're going to pass out at any time. Coumadin is affected by vitamin K. It's the antidote, so it is affected by the healthy food. We don't want you to stop eating the healthy food, which can interact with Coumadin, but talk to our dietitian about what a consistent dose looks like of vitamin K in your diet, so it doesn't go really, your INR doesn't go really high, risk of bleeding, or low. So this is why these medication treatments are useful. This is with ACE inhibitors, which meaning the class of ACE inhibitors like the ARBs and the Entresto can reduce your risk by 25 or even higher %. Beta blockers, 18 to 40%, can reduce your risk. Cholesterol lowering agents, including the new ones, by 30%, and platelet inhibitors, 25 to 33%. So the potential accumulative effect, 75% relative risk reduction compared to those people who don't take those medications. And that is why these medications are important in the context of being a heart patient or having coronary artery problems. So what's new? We would love to give you 1 pill a day. If we could, we would. You can bet that there are people working on it. Acebetastatopril with different types of medications. Sensible diet, we'd love to give you, let you know what a sensible diet looks like. Basically, Canada's Food Guide is a good way to eat. It looks almost the same as Mediterranean diet, which is known to be heart healthy. It reduces risk. We know that it does. Exercising every day and not staying still every day, it increases your chances of health and decreases your risk. Rest, waking up feeling well rested is the goal. If you're finding that you're not resting, talk to your doctor if you don't get it, if you're not getting enough. Or you can also talk to our social worker counselor as well. Relationships, so avoid the toxic relationships that increase stress and encourage the supportive relationships that decrease stress. We have a stress management workshop that we have in our cardiac rehab program, and because we know that stress plays an important part in heart disease. Alcohol, we would love to say, yeah, go ahead, drink lots of alcohol. And we used to say, if you drink alcohol, it's good. We can't say that anymore. There have been studies that came out in the past little while, the past year, that really showed there's really no benefit, which we used to think there was some drinking a glass of red wine a day. There's no benefit. But within moderation, it's not going to do any harm as long as there's no other reason for you to not drink. So if your doctor says you have cirrhosis of the liver, you shouldn't drink. If you have cardiomyopathy, you should not drink. If you have, because it can interfere with your heart. If you have heart failure that's added extra fluid, we don't want you to drink as well. Moderate intake means 0 to 1 drink a day if you're a woman, 0 to 2 if you're a man, or up to 9 drinks a week for a woman and up to 14, but not all on Saturday night. So you can have moderate amount of intake and it won't interfere with your medications or your heart. Again, as long as you don't have another reason to not drink. Size matters. So if you see 1 drink is 5 ounces of wine. It's not one of those great big wine bottles. Have you seen those things even in our gift shop? There's a wine bottle and then there's a glass attached on top of it. It said, oh, just only 1 drink, and it's like, ha ha ha. Well, it's funny, but it's not. Please do not drink that much. 1.5 ounces of liquor or 12 ounces of beer is 1 drink. We don't recommend any extra supplements as far as vitamins and minerals go for heart disease unless you have a known deficiency. So for instance, if you have vitamin B12 deficiency, your doctor will write a prescription for you for that. Vitamin D is the exception because no one gets enough vitamin D if they're over 50 in Canada because they don't get enough sunshine. So everyone should take vitamin D. So for people who are over 70, at least 800. If you're over, below 70, at least 600, up to 4,000 international units a day. Fish oils, they haven't really been proven unless you're at the higher doses, and if you have the higher doses of fish oils, it can interfere with your bleeding. So we don't recommend it. It's best to get all your vitamins and minerals by a healthy diet, one that is sustainable. Calcium supplements are controversial. There are some, it depends on the person. So if you've got a really good reason to be on calcium supplements, tell your doctor and it will be incorporated if needed. But don't start taking it on your own. Don't start taking lots of Tums on your own, which is calcium as well. Alternative or complementary medicine it's still medicine. It can still affect the body. They can be still very potent medications. They can still have side effects. Long-term effects are not always known. I'll tell you a little story. There was one man, I used to work in an OR suite a long time ago, and there was one person who came in who didn't tell us everything he was taking because he thought it was, it's just natural medication. They couldn't control the person's blood pressure in the operating room. He almost died on the table, and I will always remember that. When he did finally make it, and he woke up, and we found out what he'd been taking, licorice root. And you think, licorice root, that sounds like candy, right? It doesn't sound like anything to be worried about, but it can really affect the blood pressure. That's just one example, and there are many. If someone is telling you these supplements are really good for the heart, please talk to your doctor about them because they might interfere or make, it could interfere with the actions or make the actions more potent to the medications that you're taking. So please talk to your doctor or your pharmacist or me or one of the nurses here if you have any questions. See some of the examples of there's our popular herbal medications. Please avoid them because they can interfere with something like bleeding. St. John's wort, which is used for mild to moderate depression. Ginkgo biloba for dementia or prevention. Garlic capsules. You can eat all the garlic you want if you're eating it on your food, but don't get those big powerful pills full of garlic because it interferes with bleeding. Coenzyme Q10 is one alternative type of medication that you see, and some people were using it because it was showing great promise in reducing the joint or muscle discomfort associated with taking statins, which was great in theory, but they were waiting for this big final study a few years ago, and it didn't show any different for people taking coenzyme Q10 as though it was the same effect as people taking placebo. So that was the end result. Your doctor, you can talk to your doctor if you think it will help you, but you're not going to be on a drug plan that's going to cover that, for instance. These are some of the take-home points that I have. Make sure you make friends with your pharmacist. Your pharmacist is a great source of information. That's what they do, and they are reliable sources of information. Carry a list in your wallet of your medications. If you were ever found on the sidewalk, for instance, and not able to respond, EMS will look in your wallet to see that if they can get that list. And it's always good to have that list because every time you go to the doctor or another healthcare person, they're going to ask for a list of what you're taking and up to date. Please talk to your doctor before deciding to take yourself off medication on your own. Know why you're taking the medication, and that's good for you coming to see this workshop today. Use reliable and valid information that you can get from the website. There's a lot of misinformation out there, so use the best sources. You can ask us, You can go to Canadian Heart and Stroke Foundation, which is a good Canadian source. The Mayo Clinic and Cleveland Clinic are good sources. They're not misinformation. If you're traveling away, please carry your medications with you in your hand luggage. Don't separate yourself, because it's hard to get your medications overseas, for instance. Bring a list of your medication and your names of your doctor. Keep your medications out of your glove compartment as well, because they can be degraded by the heat in your glove compartment. So that's it for me. If you've got any questions, please talk to me or one of the other nurses. You can talk to your pharmacist or your cardiologist or your GP, all sorts of people. We're here for you. And that's it. Thank you.